It is Mental Health Awareness Week, and we are tackling the issue of mental health. It can be challenging. How do you talk with someone that you love about what they're dealing with? What signs should you look for? Well, we have an expert. Kim Romery is here from the Greater Kansas City Mental Health Coalition with some answers. And Kim, thanks so much for coming.
Thank you for having us. Now,
this coalition, tell us a little bit about this. It's an independent coalition.
We're led by Jewish Family Services of Greater Kansas City, but we're a coalition of 24 community partners, primarily mental health service organizations in the Greater Kansas City area, and we're all combining our efforts and resources to reduce the stigma that's affiliated with mental illness.
So how do we jump into this? How do we talk with someone who may be dealing with something? I guess first we have to understand what the signs are so we know there's an issue.
Absolutely. And it's just being aware of what's going on with the people that you love. So a change in behavior, that could be irritability, sleeping more, sleeping less, more anxiety, withdrawing from their usual activities. So just paying attention to those signs in your family and friends.
All right, now when we talk about this, we're talking about all ages.
Absolutely.
So let's start with the kids and to the adults. So
first of all, 1 in 5 people will have a diagnosable mental illness every year. And of those, 50% of chronic mental illnesses show up by age 14. 75% show up by age 24. So this really does affect people from childhood clear on up through their senior years.
Is this something that's genetic, or is it environmental? Is it situational that triggers something inside a person?
It can really be any of those things.
Okay.
You know, there's a lot of science behind mental illness, and of course mental illness itself is a very wide spectrum of disorders. So it can be anything from, you know, mild anxiety to things that are much more serious, like types of psychosis or bipolar disorder.
So let's get specific. What do we say to them that's going to help them, that's going to draw them out and give them comfort?
So the first thing is just to be willing to have the conversation itself. And so many times we're afraid to even start the conversation because we're afraid we're going to say the wrong thing. It's important to just say something. And so reaching out to them saying, I notice that you're not really acting like yourself lately. Is there something going on? Just letting people know that you're here for them, that you want to be able to listen to them if they have something they want to talk about, and letting them know that they're not alone. Any type of mental illness is very, very lonely. It's very isolating. And so just knowing that somebody cares about you and is willing to kind of hold your hand through that process, you don't have to know all of the answers. Just be willing to be there with them and help them find them.
What if you feel that you are alone? Where and how should we get help if we feel like we're having a problem and we don't have that wonderful friend who's there for us? When can, you know, the person themselves recognize that they can go get some help, and where do they do that?
Well, you can go to our website, which is www.itsok.us, and we have a number of resource pages on our website with local resources of where they can go to find whatever type of help they may need.
All right, great information. Kim, thanks so much for coming and for helping the mentally challenged in our community.
Thank you.
Thanks for the good advice, too.
Thanks.